Hello and welcome to another episode of Coffee and Conversation AI in Healthcare. My name is Michał Banowicz. I'm a medical doctor and senior marketing manager here at Infermedica. Today we are having a very special guest, our own and only Piotr Orzechowski, the founder and CEO of Infermedica. Piotr has dedicated his career to revolutionizing how patients access and interact with healthcare services. With a strong background in both technology and healthcare, he is uniquely positioned to share insight on the future of AI in the space. Piotr, we are excited to have you here today with us.
Thanks for having me, Michał. I'm also very excited.
It's a pleasure. So let's jump straight into the first question. In the AI debate, there's been a lot of discussion about the ethical implications of AI and in medical decision making. What's your take on this?
Well, so first, I think we should think a little bit about who makes medical decisions and what they're all about. And immediately, probably we can all think about different stakeholders who are somehow involved to some degree in decision making. And then we'll talk about AI in this. Obviously, first pick, we have doctors who make some critical decisions regarding our health. So if we think about making diagnosis, assessing the patient, deciding on the treatment plan, deciding what medications to take or not, maybe to refer a patient to a specialist or even issue a sick leave, well, those are like very serious decisions. Of course, we have many other healthcare professionals. We have nurses assisting in various parts of the patient journey, triaging patients, helping them with treatment guidelines as well. But then we have a very, very important part of this puzzle, and this is patients. All of us are patients, and I would argue that we also make very important decisions that have a huge impact on whether we're gonna get well quickly or maybe not. And every day, or maybe every other day, we maybe ask ourselves, I'm not feeling well, or maybe my kid is not feeling well. Should I go and see the doctor now? Should I, take this medication I have at home? Is it safe? Is it applicable to a 6-month-old baby? So many questions. And I think here AI has also a particular role to play, but I'll talk about this in a sec. Now, I really, really believe that AI will reshape the way we make medical decisions on all different levels in all different roles, starting from patients, all through healthcare professionals, doctors, businesses, healthcare organizations. I think there is huge potential, and there are already a number of cases emerging that we can see where AI is beginning to help, is beginning to participate in how those medical decisions are made. Think about use cases in radiology. AI is already very, very, I would say, proficient when it comes to assisting in image analysis. And there are so many studies that say that if you combine AI and radiologists together, there's increased safety, increased accuracy and detection rate. Many other use cases, not only clinical, also administrative, visit note collecting intake by listening to what the patient is saying during the visit, pre-populating the visit note. This is also AI, and the quality of this documentation has a certain impact on how decisions are made. Now, if we think about patients, ourselves, so many options, AI-powered, we can go for, and all of those things may influence the decisions we make. Think about maybe ECG or maybe heart rate monitor in your watch, detecting abnormalities. Think about medical devices you can use at home. So I think from the ethical point of view, because this is something that you mentioned in your question, manufacturers of such AI or AI-powered tools carry really huge responsibility, because this way or another, they influence the decision process, right? Whether this is healthcare professional patient, I would argue it's even more important with patients who have no clinical background. It's harder for us patients without education in medicine to know if this is right or wrong. So, but at the end of the day, at least as it's right now, obviously, the final decision related to key aspects of healthcare obviously belongs to doctors, to healthcare professionals. Will this change in the future? I don't think it's going to happen anytime soon, right? But I can imagine a future as well where AI systems are gaining more and more, let's say, freedom or capacity to, maybe in some minor, smaller decisions, really low acuity cases. And I think that's something that probably will happen to all domains of our lives, from education through self-driving cars that will take us from one place to another, accepting some responsibility, and finally in healthcare. We'll see how long that's gonna take, but I'm absolutely confident that doctors, healthcare professionals are here to stay, and they will always remain to be the ultimate medical decision maker, and they recognize this full responsibility.
Thank you. I would even flip this topic and say that in the future it will be unethical not to use AI system to support and extend healthcare professionals' capabilities by these examples that you mentioned that are making healthcare and medical sciences more extensive.
No, I love it. Absolutely.
Moving on, given your experience as an entrepreneur in the AI space, what lessons have you learned about scaling AI in healthcare that you think are crucial for success?
That's a great question. I think there are many lessons in AI in particular, but also building business in healthcare, not necessarily AI specific, but the combination of health and AI, I would argue, makes things even more challenging. So in the past 12 years, Infermedica was founded in 2012, so more than 12 years ago. We began like this very, very maybe naive approach to, the technology we started with. We thought that's gonna be a piece of a cake. We will find a business model quickly. Everything will be so easy. I couldn't be more wrong than this. I really think that building anything in healthcare itself is so much more difficult probably than in some other domains I was previously familiar with. And across those 12 years, I think every year presented some new challenges, some new learnings. It's probably difficult to summarize this, but sticking to some of the most important things, I would choose three. First, it's everything takes more time in healthcare, and especially healthcare AI. The responsibility of the manufacturer of a medical device, something I just mentioned, is so much greater than comparing to, for example, building a accounting tool maybe, or a video game, something for entertainment. Of course, those are also difficult things to do if you want to do it right. But you have huge responsibility because you are influencing medical decisions, going back to your original question. And because of that, you need to invest a lot in clinical validation, regulatory matters, certification, and this is quite unique. And if you add AI into this mix, that becomes a non-traditional kind of product you're building. So it's gonna take more time, cost more time, and then going to market also takes much more time. Like our first client we had took us 4 years. I think it was 2016 or 17 when we signed our first contract with Allianz Partners for a pilot launch of our triage tool. And we were very lucky because our investors were very patient. It wasn't easy, but we got to a point where we began to, where we got to the product market fit and were able to begin scaling. But everything takes more time. You need to be very patient, and also timing is critical. This applies to every business, but back in 2012, where we started, nobody was talking about AI. I mean, there was AI, of course, but that was before deep learning era. That was before things become much more, let's say, prevalent in market and communications. It was, again, 2016, 17, where market has become interested in applying and in applied AI. And this is when some of our first partners started reaching out to us. So again, patience and right timing. Second point I like to say, and this is something we now have, but we did not have it back in the day when we started, building strong medical foundations. In case of a medical company, medical AI company, this literally means having enough doctors around you, doctors, healthcare professionals, physicians who are impacting every part of how the organization is developing, starting with product, starting with the clinical validity, starting with a value proposition, whether what we do makes sense or not, making sure that we collect enough evidence, ingraining the medical mindset into the culture of the company you're building is also very, very important. We started with one doctor back in 2012. Today, we have a team of almost 50 medical doctors passionate about the potential of AI in healthcare. So it took us a long way to get here. Also, it wouldn't be possible without funding that we received in the meantime. So also building those medical foundations from the get-go is not always easy. But if you don't have those luxury of having access to a large, great, trained medical team, maybe you want to have a medical co-founder that's going to help you in this journey. And this is also how we started. My co-founder, Dr. Irv, helped us a lot back in the early days. And perhaps the last point that is related to our lessons, something we worked hard on in the past couple of years, and especially important in AI, healthcare AI, which is still a pretty new domain, something that has to earn trust. And I think there is work to be done still. I would call it leading with evidence and investing enough in transparency of what this is that you're working on and how well it performs, how that was created, what's the source of maybe medical content you use, what are your credentials. This all matters. This all matters for different purposes. You want to show enough evidence for example, for building trust with your users. If you cannot say how that was created, I doubt your patients, users will want to use it. Secondly, that's something you need to use when talking to your business partners. Maybe you offer this product to healthcare organizations, providers, insurance companies, payers, governments, pharma. You need to have very strong evidence, whether this is case study, peer-reviewed journal entry, much, much more. And lastly, if you want to certify your AI medical product, you need to have a lot of evidence. So, thinking about it in advance, creating teams, securing resources to build that evidence, in my opinion, is something that every AI company needs to invest in.
Thank you for that. Innovation often requires a balance between technological advancement and human intuition. In your view, what role will human creativity and empathy play in shaping the next generation of AI-driven healthcare solutions?
Well, yeah, so I think that the role of empathy cannot be underestimated. And I kind of feel that the legacy or existing AI systems lacked empathy so far, right? And we're probably all familiar with different kinds of AI-based agents, or maybe conversational agents, or maybe apps agents that try to pretend that they're actually conversational, but I would argue if they really are. So think about maybe chatbots, voice bots, automated call centers. Think about this automated voice bot you have in your bank line or something like that. I think they still feel uncanny for a number of reasons. They do not feel to me like they have enough empathy, or they do not resemble this experience of interacting with a real human being. And by the way, it's not the goal to pretend that there is a real human on the phone, but you want to get rid of this uncanny vibe that I'm talking to a metal box, digital metal box. And I think think about maybe this AI voice bot in your bank, right? To me, oftentimes, and I have not tried all of them, just the ones I use for myself, it feels to me that it's just a matter of, let's say, it's just like a translated online form that someone inserted into the phone line. You are restricted to the finite choices. Say one, say two, say three if you want to talk to the operator, say one if you want to check on your account balance. And this is not how humans interact with one another. So it's too rigid, too restricted. You don't have this luxury of actually saying what you want to do precisely. Secondly, still, I think this voice synthesis, the audio that we hear does not convey enough emotion. And I think it speaks well, maybe even too well. Maybe it's even too precise, too accurate in pronunciation and everything, but it's not spontaneous, It does not carry enough spontaneous reaction to what you're saying. I think it's more of a technical problem, technical challenge here. And I think we have improved a lot in the past year or two. There are really decent voice synthesis tools available, but I'm wondering if those are enough. But in the next couple of years, for sure, we'll get to something that will become much harder to distinguish from speaking to a real human. And with this, there is yet another technical problem, which is latency. So this delay you get when you talk to this bank voice bot, you say for a second, even if you wait for half a second, it's something off slightly, right? So of course we could go on and on when it comes to maybe starting with this empathy. It's more than empathy. It's about human experience that's required to make us trust and interact more and more willingly with such tools, right? Because it's all about willingness. It's all about, and especially in healthcare, it's all about whether you trust the final recommendation or not. So going back to your question, I'm confident that next gen AI tools will need to overcome those challenges and restrictions and limitations. The goal here is to make this experience almost indistinguishable from talking to human nurse, human doctor, human assistant. This is what it's all about. And it's, again, not about pretending that there is a real human on the phone. It should be absolutely transparent and clear that, yes, we're talking to a very, very well, human kind of like conversational voice bot agent, but it's not a real human. I really think that empathy here is critical, and probably all of those agents should have some sort of capability to hand off certain conversations to real human agents. So like keeping this human in the loop, healthcare professional in our case, I think this will also be a critical component of how next-gen AI is going to be developed. Before you have a fully autonomous self-driving car, right? There was this engineer or somebody supervising how well it drives. And only then, once you collect enough evidence, once you run enough clinical trials, once you run through the proper clinical validation certification, you're confident that this will not cause harm, then you can start minimizing this human in the loop component. So that's how I would approach it, at least.
Thank you. Thank you so much. Currently, whenever I'm contacting banks chatbot, my first inquiry or question is, please connect me with a professional service
Exactly.
provider. This is
I do
my
the
current
same. I do the
this is my
same,
current approach.
but I also feel that there are some better solutions, new
Mhm.
solutions in the market. The question is, I mean, not question, but the challenge that they have is they need to fix this mindset that was broken. That was, a mindset that was broken probably by legacy AI voice bots. So, like, your thought, or my first thought is, oh, I don't like AI agents on the call
Mhm.
center, the voice line, because they don't work at all. So, even though you have a much more powerful solution today, you face a challenge that you need to convince people to try this yet again, right? And I guess you get
Right,
only one shot.
right. Thank you. This is a great perspective. And my last question for today, the intersection of AI and healthcare is often seen through a clinical lens. But let's step outside of that for a moment. How do you envision AI transforming the patient experience beyond the clinic or hospital, perhaps in everyday life, in ways we haven't yet imagined?
Great question. I love it. And what we do at Infermedica is all about supporting patients in making right decisions when they're feeling unwell. And this is exactly where and how we want to apply AI. So let me start with something that's pretty commonly known, and this is obvious, which is there are not enough healthcare professionals globally. And we are seeing a global challenge in accessing doctors or healthcare in general. Wait time increases, availability of doctors declines. We see overcrowded emergency rooms. This is also why people turn to whatever they have at hand to learn about their health, learn about their symptoms. This is why people are so eager to use internet, search in Google, search online. This is why people are eager to use ChatGPT to talk about their health issues, because it's not easy to meet with your primary care professionals. Those are very busy people. And I really think that there is a bigger gap between demand and availability of healthcare services, and AI has a potential to fill this gap. How? I think we mentioned some ideas already in our conversation, but I'll go back again to this maybe analogy with self-driving cars. Um, Self-driving cars already exist, right? In China, in the US, in other parts of the world. I think they are getting into fairly advanced stage of deployment, which is great. Of course, we still have to be very, very careful. There are many challenges, technical, ethical, safety, that still have to be resolved. But probably in 5 to 10 years from now, those self-driving cars, autonomous vehicles we'll see them more as a norm, something like everyday. And I think probably something similar in some time in the future will happen to how patients perceive accessing primary care. So imagine a self-care bot, something you have in your pocket, something that lives inside of your phone. This bot is integrated to your personal health record, knows about any medications you have, family history. This bot is connected to your wearable devices, maybe to your watch. Maybe you have some other devices at home, smart weight. Maybe you have, how do you call it, pressure cuff? How do you measure blood pressure? Is that how you say it in English?
Yeah.
Thermometer. So different ways, different devices that can collect vital signs, some physical data points. Who knows? Maybe this bot is connected to your electronic health record. Maybe it's connected to some of your genetic genetic risk factors if you maybe had your genome sequence or something like that in the future. So I would argue that this self-care bot that lives in the phone, knows the data that you allowed it to know, is probably has better access to knowing about you than your today's family doctor, unfortunately. But that's the reality. Everybody would need to have a personal family doctor to make this work. So we are already starting with a huge advantage of the luxury of access to very holistic data points if you are a self-care bot. And now imagine this bot is fueled by highly curated, certified medical knowledge, graph of information about common diseases, self-treatment methods, patient education, medications. And whenever you get sick, right? Or maybe somebody's in your family, maybe your kid is getting sick and you're wondering what to do next, it's gonna be much easier to talk to this self-care bot first before you call your doctor. But in order for this to happen, is that the self-care bot would have to be really robust, right? Secondly, you need to, if it's robust, you'll need to trust this bot, which brings us back to this empathy and conversational capabilities. And lastly, it must be legal. It cannot be illegal, you know? You cannot download it from some dark web or something like that. It should be something which is advised by some healthcare authority. Maybe, you know, your Ministry of Health says, before you book an appointment with your family doctor or your specialist, before you go to emergency room, use this bot because we trust it, we evaluated it carefully, and it's going to triage your symptoms and advise on the next proper step. So I think one way or another, this is absolutely the future of how we will use healthcare, fully personalized, supported by AI that pulls data from different devices, different data points, and based on validated, curated knowledge graph, it can advise on the next step. And I'm not saying it's going to replace doctors. Absolutely not. I see in 10 years from now, doctors, there will be even fewer doctors than we're having today. We're not training enough doctors. They will be even busier than we have today. So what choice do you have? I think it's ethical, going back to your first question. If you have common cold, if you have migraine, if you have something that you can start treating at home, stay at home. Treat yourself at home with the use of proper validated self-care recommendation before you utilize the physical interaction with the doctor, which will be very scarce. So I think it makes everybody win because patients get assurance like immediately. They get proper recommendation on what to do next. At the same time, we save scarce clinical resources, very precious ones. And on the economic side of things, obviously, also great impact. And my vision here, how I want to contribute to the future of healthcare, I really want everybody to have such a self-care bot in their pocket so that everyone can become a small chief medical officer at their house, making sure that they make best decisions for themselves, for their family, and decisions that are better for the entire system as well.
Love it. Empowered patients, an equal conversation partner for a physician, for better healthcare and for better health of our families and our own. Thank you. Thank you so much for this vision again. And that's a wrap. Our guest today was Piotr Orzechowski, the CEO of Infermedica. Piotr, thank you for taking some time to talk to me and have a great rest of the day.
Thank you, Michał. Thanks, everyone. It was a pleasure.
Thank you.